After any major illness, whether it's a fracture, a heart attack, a major surgery, or a head injury, the patient requires a period of rehabilitation to regain their optimal functioning. Similarly, a patient of mental health problems, especially when it's a prolonged one, requires a period of rehabilitation. Mental health rehabilitation helps these disabled individuals to regain their emotional, interpersonal, social, and intellectual skills to live, learn, and work in their community independently or with the minimum amount of support. The World Health Organization recommends community-based psychosocial rehabilitation to maximize the quality of life and to ensure the participation of the patient's relatives and other community members in the recovery of the patient. This is an integrative model that consolidates the contributions of multiple professionals, including doctors, psychiatrists, psychologists, community health workers, nurses, and vocational trainers, along with the patient's key caretakers. It also sensitizes and educates the community members about the mental illness in order to reduce the stigma associated with mental illness, which is a major factor in slowing the recovery of the patients. What is independent living? Independent living involves doing well in job or in school, in family life, and in community living. The main requirement for independent living is the ability to take care of one's own personal needs and medical needs without assistance. The patient should be able to manage one's own medication and money without any assistance. A job is very important. Sustained employment is associated with control of psychiatric symptoms, increased self-confidence, increased satisfaction, and reduced treatment costs. Work also gives the patient a satisfying sense of contributing positively to the society. Since each individual is unique, a good psychosocial program will understand that the recoveries are also unique. Since each individual is unique, a good psychosocial program recognizes that the recovery process will also be unique. The recovery process will not only be affected by the type of illness, but also by the patient and community characteristics and other environmental factors. It should be carried out in real life situations, and the goals should be identified by the patient. Even in the most disabled patient, there are surviving strengths. A good program should utilize these skills of the patient. This year's theme for the World Mental Health Day states that mental health is a universal human right. It is the duty of each member of the society to ensure that effective psychosocial rehabilitation is made available to every mentally disabled patient. It is the duty of every member of the society to ensure that effective psychosocial rehabilitation is made available to each patient who is disabled by serious mental illness.